All right, this is the Stryker ICU beds. So this is a video on how to work the controls and what the beds are capable of doing. So at the foot of the bed, there will be a screen. If it is black, just touch it and it'll wake the screen up. Along the bottom are the different options. So the first option is the settings, the bed positioning. So the left-hand side is how to raise and lower the bed. If you press the up arrow, it'll change the position of the bed. Down arrow will lower it. And then the center positions are the different three positions on the actual bed that will move, that move independently of each other. So you have the head of the bed that will rise. You have the knees that will rise. And then you have the foot section of the bed that actually goes down to relieve pressure on the heels. So those are the three different settings of the bed. So as you come up, you can readjust anything to the setting you want. It will give you the degrees that are set here for the elevation of the bed. So it's 16 degrees of head elevation. It should show that there. So anybody with a feeding tube, peg placement, that has to have the bed locked out at 30 degrees, that should show 30 degrees. There's also a 30-degree button on the handrail that I'll show you that automatically takes the patient to 30 degrees. So that is the settings for this. Trendelenburg is here, and reverse Trendelenburg is there. And again, you can tell if it's flattened out again because you'll get a 0-degree reading there. And I'm gonna flatten out the mattress back to the starting position. Okay. Then below that is the scale. That would be for weighing the patient. A patient has to be on the bed for the scale to be set. Zeroed out right now at 0 degrees. If a patient was in it, it would give you the patient's current body weight. That is also detrimental for setting an alarm. If there is no weight set for the alarm, then the alarm cannot be set. So have nursing, if you need to have any issues, have them reset the bed for the proper weight. The next button is bed exit. The bed exit has 3 different positions of the bed. That's how the zones, zone 1, zone 2, zone 3. A normal standard for the hospital is everybody is on zone 2. So to set the alarm, you would hit arm and then you would push the setting you want. It will show up in green. The box will turn green and it is set. It's telling me I can't do it because there's no weighted patient in the bed. So you will not get that screen if a patient's in the bed. To turn off an alarm when you come into the room, the alarm will show up that there's a bed exit button there. You're gonna hit dismiss and that will turn off the alarm. It will give you a question like, do you want to turn it off for 20 minutes, or 20 seconds, 30 seconds, but you can just hit dismiss completely and we'll turn off the alarm. The other one, next button is the surface button. The surface button has the pressure relief. It tells you the softness or the firmness of the bed. It also has a lateral rotation button that actually rotates the patient automatically throughout the shift. So if you're going to be for therapy, if you're getting the patient up for any reason, you do want to turn that off. So you would go to this screen, turn off the lateral rotation, then get the patient up. Same with turn assist. That's a buttons to use to actually help turn a patient. It partially brings them over to one side to make it easier for staff to reposition patients. Again, making sure that those are turned off when you're actually having the patient physically move in the bed. The next button, the final button, is the max inflate. If you needed to inflate the mattress quickly to get a firmer surface, you would hit the max inflate button and raise the surface. So those are the major components to the screen. The lockout button, this will lock out any position on the bed. And it even asks for patient controls only, or anything. You can individually lock out a position where the patient cannot control it. Okay. Down to the left of that screen, this is the 30-degree plus button. So if you hold that in, it is going to bring the head of the bed to 30 degrees and it will not go past the 30. And I will show you the scale on the bed rail in a minute. The brake, when it's lit up, it is on. To take the brake off, you click the N button. The red light will come off of the brake, the stop sign, and the end will light up. The bottom of the bed will flash, telling you that the brake is not set, and now the bed can be moved to any position that you need it in the room. To reset the brake, you just hit the brake button, and the brake will again show red, and then the brake is set. So coming to the side of the bed, the 30-degree angle is marked on the bed rail, so it should match the arrow on the left-hand side, and that will give you the angle of the bed. The bed rails themselves turn into one complete bed rail when up. There's one long bed rail. To move it, press the yellow button, and it drops below the bed. Same with the top button, drops below the bed. To bring them up, you know, make sure they click into place, and it is locked. There's a hand control panel for the patient, which sits in the bed rail, and it is a call light. Not all of the things work with our system here at the hospital, so they do have another nurse's call light that will be with them as well, but this is used for the adjustment of the bed, head and legs. They do not have the foot adjustment on this one, only the head and the legs like the standard hospital beds. So this will be in with the patient a lot of times or stuck to the bed rail. And then at the top again are all of the patient controls here that you can adjust from outside the bed. All three positions for the body, the raising and the lowering of the bed itself, the Trendelenburg and reverse Trendelenburg button. And then there is also a seated position, which if you press and hold completely, it'll bring the bed up into a seated position. And again, there is a brake button at this end of the bed, as well as a drive button and a brake off button. For CPR, if the mattress is inflated, there's a CPR tab to pull to deflate the mattress, and on the bed itself to lower it, there's a CPR foot pedal to do that.